Olive is 10 years old, 10 and a half, she would correct me, and she is in 5th grade. She's the bravest girl I know. She loves to make people laugh. She's so kind. She has the biggest heart that I know, and especially with her friends. She doesn't want to hurt anybody's feelings. In preschool, everything was tinier and smaller, and it wasn't until kindergarten that she couldn't even get in the bus, like the steps to get in there, and I was like, oh, that's interesting.
I think I remember telling my mom I didn't want to ride the bus, and then when I got to school, everyone just thought I wasn't in the right class.
It's probably the size of a 3-year-old going into kindergarten with mainly 6-year-olds, 5 and 6-year-olds.
At recess, I couldn't get up on the tall blue bar. And in 3rd grade, I couldn't reach the sink in the bathroom, so I would bring a stool every time I went to the bathroom just to reach the sink.
It was very hard, and it was not quick. Ethan, all look good? Yeah. When we got the diagnosis, we found that there was something that could be done. And that we weren't just shooting in the dark at anything and throwing more calories at her or taking shots she didn't need and weren't going to do anything. Like, this was a definitive diagnosis. Her 4th endocrinologist, she drew a picture of what this means, and your pituitary gland spits out growth hormone, and most people think that's what helps you grow, but only a portion of that goes to your bones, the rest goes to your liver, and it's in Olive's liver cell that is not producing IGF-1, so that's where it would produce it, and that's what helps you grow. It's there that it's breaking down and it's not doing what it's supposed to.
Increlex is used to treat children who are very short for their age because they have a condition called severe primary IGF-1 deficiency. Increlex should not be used for other causes of growth failure and should not be used instead of growth hormone. Your child should not take Increlex if he or she has finished growing, has cancer, or is allergic to megasermin or any of the inactive ingredients in Increlex. Your child should never receive Increlex through a vein.
She took Increlex, in that first year she grew 5 inches, and that in the 2nd year 3 inches. So just in 2 years alone, she grew 8 inches.
It helped me grow, and for me, now I'm on the charts. And when I was 2, I wasn't on the chart, and so it helped me grow a lot faster.
Every 4 months, she goes to the endocrinologist for her checkup. When they took her height and weight and they plotted it, she had hit the 1 percentile, and we were so excited that in the doctor's office we did a little dance, and of course we texted my husband, her dad, and we called my parents. I mean, everybody was excited because they've all been following her journey with us.
Yeah, I was really excited when I knew I was catching up to my other friends.
You grew? 1/4 inch? 1/2 inch?
I'm grateful for this experience, something that she can do, and she's seen the results, but she is just grown as a kind human being through this too. So yeah, I'm very grateful.
Indication. Increlex mecasermin is a prescription medicine used in children 2 years and older with short stature that have severely low levels of the hormone, insulin-like growth factor 1, IGF-1. IGF-1 is needed for normal growth. Increlex is not a substitute for growth hormone. It cannot be used for children with short stature due to low levels of growth hormone, malnutrition, when their thyroid gland doesn't make enough thyroid hormone, or when taking anti-inflammatory steroids used to manage inflammation. Important safety information. Always give Increlex exactly as your doctor directed. Do not take Increlex if you are allergic to IGF-1 or any of its other ingredients. Report any allergic reactions. Increlex should be injected under the skin. Subcutaneous injection. It should not be injected directly into a blood vessel. Increlex should not be used after growth plates close, which happens during puberty. Increlex should not be used in children with cancerous tumors or a history of cancer. Hypoglycemia, low blood sugar. Increlex should be administered 20 minutes before or after a meal or snack and should not be administered when the meal or snack is skipped. Checking blood glucose levels is recommended. The dose of Increlex may need to be adjusted until an appropriate dose is decided by your doctor. Intracranial hypertension. Increased pressure in your skull may occur because of cerebrospinal fluid buildup around your brain. Therefore, your doctor may require an eye examination at the start of Increlex treatment and periodically during the time you are taking Increlex. Lymphoid tissue hypertrophy. Lymphoid tissue hypertrophy is a non-cancerous increase in the number of immune cells called lymphocytes. Patients should have periodic examinations with your doctor to rule out potential complications. Slipped capital femoral epiphysis. Slipped capital femoral epiphysis is a bone problem where the top of the upper leg, femur, slips apart. This may lead to a serious condition where bone tissue dies due to a lack of blood supply, osteonecrosis. Get medical help for your child right away if your child develops a limp or has hip or knee pain. Progression of scoliosis. Your doctor will monitor you during treatment with Increlex if you have a history of scoliosis. Malignant neoplasia. There have been reports of cancerous tumors in children who received Increlex. It is unknown whether there is any relationship between Increlex therapy and new occurrence of tumors. Tumors were mostly reported in patients with rare genetic conditions of short stature associated with a higher risk of cancer, or in patients already at risk of cancer. The tumors were seen more frequently in patients who received Increlex at higher than recommended doses or at doses that produced IGF-1 levels above normal for age and sex. Your doctor will carefully monitor you during your treatment with Increlex for development of tumors. If cancerous tumors develop, your doctor will stop your Increlex treatment. Risk of serious adverse reactions in infants due to benzyl alcohol preserved solution. Serious and fatal adverse reactions can occur in neonates and infants treated with benzyl alcohol preserved drugs. Use of Increlex in infants is not recommended. The most common adverse reactions include low blood sugar, reactions at the injection site or throughout your body, and enlarged tonsils. You are encouraged to report negative side effects of prescription drugs by contacting Eton Pharmaceuticals, Inc. at 1-855-224-0233 or the U.S. Food and Drug Administration. FDA at www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information for more information. Increlex.com/wp-content/upload/2025/11/Increlex- combined-label-2178-v2.pdf